Hello. I'm not sure backed by popular demand. In fact, I'm fairly certain it's not backed by popular demand. But that said, this is the first of a one-on-one, an interview with. And today I'm delighted to be joined by Dr. Kate Ross, who's consultant clinical psychologist. Kate is always very thoughtful and reflective. So I'm feeling slightly anxious as we have this one-to-one, Kate. So I'm in your hands.
So, as you say, quite rightly, our new values are people, partnership, empowerment.
Yeah.
Can you put a bit of flesh on those bones? What do they mean to you?
Yeah, sure. Well, let's start with people. You know, people, it's the global term. Is that a service user? Is that a carer? Is it a member of staff? You know, who is the person? And it's a question of us thinking first and foremost about the individual, the person, people. It's about doing the right thing by the individual, by the person, when they need it. It's about negotiating, whoever you are, whatever the relationship is, but it's about respecting and valuing each other. That's what's important to me. And Kate, you know better than I. If staff feel engaged, if they feel respected and valued, they're far more effective when it comes to delivering outcomes for our service users, our patients. If our service users feel they're being listened to and responded, co-production becomes the norm. And that's what we should be about, putting the individual central to everything we're doing. Trips off the tongue of someone like me, but how do 8,500 people in this organisation deploy that, Kate? But that's what I mean about empowering the individual.
So you've talked quite a lot about what you're hoping around people. Tell me a bit more about our partnerships.
Sure. They're essential. They are the lifeblood. They are the future. You know, we use a lot of jargon, don't we? We talk about integrated care systems. We talk about the STPs, the sustainability and partnership arrangements. But at the end of the day, if you boil it down, what's at the essence of all of that? It's a new relationship with our partners. And I think for us, Kate, one of the things we've got to be clear about in the new organisation, so who are our partners? Who are the key stakeholders we need to be developing new relationships with? One of the fundamental reasons for bringing this new organisation together, birthing it, was so we could provide integrated care. And I don't think one size will fit all, Kate. I think integration will mean different things to different client groups, to different teams at different times. We need to be smart enough, to be flexible enough to challenge the way we do things around here and to change it, ensuring we're taking that integrated approach. We're actually taking a complete walk around the service user. And as the new organisation, we should, on the whole, be able to meet all of their needs. Now, what's the best way of doing that within your team and the next team? I think that's for teams to determine. But the Lichfield example, I think, is a great example. I've talked about the work that Lichfield, but I'm aware that the Lichfield model is deploying across the whole of our patch. But fundamentally, one of the STP aspirations is to give far more effective packages of care to individuals who are frail, they have comorbidities. So effectively, what the Lichfield team is about is bringing general practice with physical healthcare, mental health care together to be able to ensure that we're meeting all of the complex needs of that individual from one place with one coordinated approach. Now, that's got to be the future.
Well, and I think that leads us really nicely into empowerment. What do you think empowerment means?
At one level, I think it's straightforward. At another level, I think it's quite complex. But it builds on everything we've talked about in terms of getting it right for and with people, getting it right in partnership. It's actually putting the individual at the centre of it and making sure, for whatever reason, we are respecting, we're valuing, we are empowering that individual, we're liberating that individual to make a difference for themselves through health promotion, through managing wellness in a different way, through the recovery college, but equally through our staff, because genuinely I believe teams know best. And people shouldn't have to look up. If people are working within boundaries, within legitimate rules, they know what's right, then teams should be empowered. Teams should be able, on the whole, to make the right decisions at the right time. That, to me, is the sense of what empowerment is. It's allowing people to do the right thing at the right time without having to look up.
So, Neil, you're painting me a picture here, and I guess it's always through the lens of the listener, isn't it? So I'm very familiar with mental health of older people, and the idea that you would take the same set of human values to everybody and treat people, staff, service users, the wider community as all equals in the same pot is very interesting to me. And I think empowerment and partnership has a very powerful thing to play, powerful part to play in that. I'm also excited to hear how the combining of physical and mental health services together might inform us about that. So I'm very familiar about shared decision making from a mental health point of view, but I really am looking forward to getting some input from my physical health colleagues on how that spans across the full range of services.
And I'm pleased that people like you are excited, because genuinely what I have seen, Kate, from the physical health perspective, from district nurses, from school nurses, from speech and language therapists, is again a real desire to co-produce with the psychological, the mental health aspects. And I think if you bring that together, and if we can achieve that, Kate, and time's against us, but if we can achieve something that will hold water in the next 12 months in the way that you've described, then I think the people of Staffordshire and beyond, Shropshire, will have a far better deal than they have today.